Here, Kemri, as you are aware, has been the forefront in the fight against COVID-19, not only within Kenya, but in the Africa region. One of the expertise that we have managed, or which we are not only supporting the Ministry of Health and the other African countries, is the issue of tracking the COVID variants, or the type of COVID that is circulating in the country or in the world, especially for this region. It is very important to track the variants of COVID because COVID changes. Today you had the first time, we had another one called Delta. Then afterwards it was changed to Omicron. Then we have right now other also called sub-Omicrons. So they keep changing. And as they are keeping changing, they have an impact, number one, on transmissibility, how they are transmitted. Others are transmitted faster than others. Also on disease progression, when you get infected, how fast you get the disease. Then mostly again on vaccines. Some variants may come which the vaccines are not able to actually have an effect on. Then some other variants which may come in may also be due in terms of treatment. They might not, the treatment that's coming up for COVID, they might not be able to actually be enough to be able to know if they are sensitive to those particular treatments. So it's very, very important to track the variants because of the changing nature of this particular COVID every time. And why we are here today is that we have that expertise to do what is called sequencing and bioinformatics to know the type of variants that circulate in the country. And we are now training others from the Africa region so that they can also be able to track in the areas. Because we have been receiving samples from various African countries, sending it to us in Kemri to be able to sequence them and know what type of variant they have.
Kwa sababu ya haya mafunzo ambayo tunayoyafanya ataweza kunufaisha wananchi kwa sababu hizi samples zikichukuliwa kutoka katika zahanati fulani ama katika mahospitali ambapo tunapoenda tutaweza kujua haya magonjwa yanaenea kiwango gani na ni nini ambayo tunastahili kuweka ili tupate kuzuia haya magonjwa ili yasije yakatuumiza. Na unaona magonjwa siku hizi unapata leo kama vile corona venye ilianza tulianzia case moja ikakuja imeongezeka kukakuwa na watu wengi ambao wamepata haya maradhi, lakini sasa tukienda mbele na build capacity tutaweza kushinda haya makali ya magonjwa kwa sababu tutaweza kuweka mikakati tofauti ili kuzuia the spread of these diseases.